101. We have been talking about dialysis for 2 days now. No, we're talking about kidney disease for the past 2 days now. And we also have been talking about kidney preventive measure for kidney disease. We also talk about chronic kidney disease. So we have been definitely talking about kidney for the past 2 days now. Excuse me. So in today's live broadcast, we're going to be placing emphasis on dialysis treatment for kidney failure. Yes, dialysis treatment for kidney failure. So, when you get 101, all we do is to create healthcare awareness. Okay? We create healthcare awareness. And we strongly believe that prevention is better than cure. So we do create healthcare awareness in Gateway 101. We educate the community. We'll go around the community making programs, creating healthcare awarenesses, creating preventive tips and simple home remedy to help alleviate pains. It's all we do. We do not diagnose or treat. Okay, so get that straight up. All we do is to create healthcare awareness. We give you preventive tips and all that. So without wasting your much time, let's dive into it. Without wasting much time, let's go into today's business. So in today's business, we're going to be talking about what is dialysis treatment for kidney failure. Okay, and we said that dialysis is a life-saving treatment used when kidney can no longer do their job properly due to kidney failure. Dialysis is a life-saving treatment used when the kidney can no longer do their job properly due to kidney failure. So think of it as an artificial kidney support system. Please kindly subscribe to my YouTube channel, Gateway 101. We're talking about dialysis today. Please kindly subscribe, kindly subscribe, kindly subscribe. Thank you. Thank you for subscribing. The good Lord will bless you. Thank you for subscribing. The good Lord will bless you. So we're talking about dialysis. I will say that dialysis is a life-saving treatment used when the kidney can no longer do their job properly due to kidney failure. So think of it as an artificial kidney support system. So when the kidney fail, waste product, extra fluid, and toxic will build up in the blood. When the kidney fails, there will be a toxic buildup. There will be a waste buildup in the blood. So dialysis help remove them. Okay, there's what we call dialyzer, which is also, in the layman language, it is also known as artificial kidney. Dialyzer is what acts as kidney in the filtration of waste from the blood. It also filters excess fluid from the body. Okay, so when the kidney fail, waste product, extra fluid, and toxic build up in the body. So dialysis help remove them. So what dialysis does is dialysis help the body by removing waste products like urine and creatinine. Do not forget creatinine is a waste product of muscle. So dialysis help remove this waste product from the body. Dialysis also help in balancing electrolyte like sodium, potassium, and bicarbonate. Dialysis also help in removing extra water to prevent swelling and breathlessness. So, helping control blood pressure. Okay, because when there's a waste buildup in the body and the kidney can no longer filter those excess fluid in the body, this might lead to high blood pressure. Okay, so dialysis help control blood pressure in a way that it filter out this excess fluid and also filter out this waste product from the bloodstream. So dialysis does not cure kidney failure. So get that right. Dialysis does not cure kidney failure, but it keeps you alive and healthier while waiting for a kidney transplant or managing long-term kidney disease. So when is dialysis needed? Dialysis is usually started when kidney function becomes very low. Often, the glomerular filtration rate is less than 10 to 15 ml per minute. So severe symptoms of kidney failure appear such as extreme fatigue, swelling in leg, face, shortness of breath, confusion, persistent nausea, vomiting, dangerous high potassium level. Okay, so dialysis is usually started when the kidney function become very low, about 10 to 15 ml per minute. So type of dialysis. There are two main types of dialysis. You have the hemodialysis, which is blood dialysis. This is the most common type. How it works. Blood is taken out of the body through a tube. Excuse me. Yep. So, hemodialysis, which is blood dialysis, is the most common type. How it works. Blood is taken out of the body through a tube and is passed through a dialysis machine, which is also filter. You clean the blood and it's returned back into the body. Where is it done? Usually in a dialysis center or hospital, sometime at home. Schedule about 3 times per week. Each session lasts about 3 to 5 hours. Necessary need, you need a special connection to blood vessels, such as AV fistula, best long-term oxygen, graft, catheter, which is also temporary, which is also known as vascad. It's a tube placed directly to the heart, and it's also used to pull out blood running through the machine to clean the blood and before turning it back. But it's normally used for temporarily. Okay, so we also have peritoneal dialysis, which is belly dialysis. This uses the lining of your abdomen, peritoneum, as a natural filter. How it works: a cleaning fluid is put into the belly through a catheter. So waste pass from blood into the fluid. The fluid is drained out and replaced with a new one. So what is CAPD? CAPD done manually several times a day, while APD done automatically at night using a machine. So what are the advantages? Can it be done at home? More flexible lifestyle. Benefit of dialysis. Dialysis can reduce swelling. It can also improve appetite and energy. It can prevent dangerous toxic buildup in the body. And it can also help prolong life. Excuse me. Possible side effects and challenges. Some people may experience low blood pressure during hemodialysis, muscle cramp, fatigue after session. So infection risk, catheter or fistula. Yeah, the vascular is at a very great risk for infection because it needs straight to your heart, and that can be dangerous. Okay, so dialysis is a kidney transplant. Dialysis is ongoing treatment to replace a kidney function. Ongoing treatment to replace a kidney function. Transplant new kidney that can restore more normal health. So we'll be looking at the two things. So we'll be looking at the two things: dialysis versus kidney transplant. So dialysis is ongoing treatment to replace kidney function, while transplant is a new kidney that can restore more normal life. A transplant is often the best long-term option for eligible patient. What's important? Life support while on kidney. Patients often need low sugar, low potassium diet, fluid control, regular medication like phosphorate binder, monitoring for anemia and bone health. Okay, so let's talk about any sign of dialysis. Yeah, explain what early sign and dialysis may be approaching. Okay, so dialysis is a scary word, and going the early warning sign can help you act sooner, not later. So dialysis is usually needed when the kidneys are no longer able to remove the toxic waste in the body and extreme fluid from the body. So most people don't wake up one time needing dialysis. Suddenly, they are often sign that kidney failure is generated. Advanced dialysis. Here are the early signs a system may be approaching as explained earlier. So talking about worsening fatigue, a weakness. When kidney failure, toxic buildup in the anemia and become common. Okay, so you may notice feeling exhausted even after rest. You will be noticing low energy for daily tasks. You're also going to be noticing weakness or dizziness for daily tasks. So this happens because kidney people help control red blood cell production. Increases swelling, edema. Remember, we talk a lot about edema too. So we're saying that failing kidney cannot remove the extra fluid used. So watch for swelling in your feet and ankle, leg, and hands. As face, especially around the eyes, swelling thick. Failure can keep getting worse is a big clue. Shortness of breath. This can happen due to fluid buildup in the lungs, severe anemia. For so shortness of breath can be a very deadly sign. This can happen due to binding building as okay. So shortness of breath. This can happen due to fluid buildup in the lungs, severe anemia. You may feel tiredness when walking short distance, when laying flat, even at rest. In severe cases, there is urgent warning sign. Okay, it's an urgent warning sign. So persistent nausea and vomiting or poor appetite as waste rises in the blood, uremia, digestion is affected. Common symptoms will be nausea, vomiting, food treatment, and weight loss from a place of work. So itching all over, uric purity, kidney remove clean, toxic, and balanced minerals. So with kidney failure, you may get constant itching, burning, dry skin, worsen itching at all. So this can be a sign of advanced disease. Change urination. Dialysis become more likely when urine output drops. Very little urine, foamy urine, optional. Then dark or bloody urine, frequent nightmare, urinating, and so frequent nighttime urination early on, then reduce later. Difficulty controlling blood pressure, kidney regulate blood pressure, advanced kidney disease may cause high blood pressure despite medication or headache. Upon high blood pressure may cause headache. Avant blood pressure may also cause fluid. So keep that in mind. Uncontrollable blood pressure often signal progression, confusion, trouble concentrating, or sleeplessness. Toxic buildup can affect the brain. So you may notice brain fog, memory problem, excessive spinach, confusion in severe area. These are late warning signs. Muscle cramp, restless leg. So we have muscle cramp, poor painful leg cramps, twitching muscle, restless muscle. That's about the late warning sign. Abdominal lab results suggest dialysis is now. Doctor rely heavily on lab, but not symptom alone. So if the glomerular filtration rate is less than 15, stage 5 kidney failure, dialysis planning usually begin. High creatinine and BU indicate waste buildup. High potassium, dangerous, can cause heart rhythm problem. Metabolic acidosis, blood becomes too acidic. Several protein in urine show ongoing kidney damage. When dialysis usually started, dialysis is considered when the glomerular rate is less than 5 to 15 and symptoms become difficult to control, such as fluid overload, high potassium, severe nausea, vomiting, confusion, pericardium, like imaging inflammation. Okay, so urgent sign: go to the ER immediately to seek emergency care if someone with kidney disease has severe shortness of blood, chest pain, very high blood pressure, confusion, or fainting, swelling, or something. So those are early signs of kidney. So the good news is, if dialysis may be approaching, doctors help you prepare early, but yeah, with kidney-friendly diet, medication to deregulate the body. Okay, so one quick, so I can guide you better. Okay, so glomerular filtration rate is very important for the team right now because they don't go to the market to buy stuff that they will not need. Okay, so this is get well 101. Okay, this is get well 101. Thank you all for watching. Okay, so to come your way again tomorrow, this is get well 101. Thank you for subscribing and thank you for liking the channel. Thank you so much. Bye for now. Bye.